shoulder blankets get released. Restriction. Up and down. Just feeling what we are going to work on. Assessing with our touch, with palpation, checking for the joint mobility, and applying motion. From the toes towards the heel and the ankle and back. Ankle, heel, midfoot, plantar and dorsal, the ball foot, and the toes. Rolling the toes between the fingers, gently flourishing the phalanges, wide stroke, broad, heel to toes. 1, 2, 3, moving from central to more lateral, to the base of the 5th and the 4th and the 1st metacarpal bones. Outer and the inner side of the foot. Here. Adding more motion. Cross foot strokes, still afterage. Again, same direction, moving from the heel to toes. Across the surface of the foot. With my fingers and palms. Opposite directions. Affleration metatarsal area. Moving towards the toes. Change into diagonal direction. And the opposite. Applying more pressure. We have already enough lotion on the foot. First starting with the inner side, medial side of the foot. Moving from the heel. Circular motions on the heel while supporting the ankle. So my thumb and the second finger are on the ankle joint. While my 3 other fingers moving around the heel towards the ankle, Achilles tendon, and the heel, and up. Up means towards the toes, distal, Feeling the first metatarsal bone. And moving along to the head of the first metatarsal. Going back. Checking for the first and second row of tarsal bones. Navicular, cuneiform, the base of the metatarsal, and up. Fascial restrictions along the plantar surface of first metatarsal. Here we are. Just moving in small circles. Bigger circle. And moving along. I use some of my tools. Volcanic stone hook-like motion, mobilizing the fascia. The opposite side. Moving proximal from the toes to the heel. Circular motion. Wide and broad. And applying acupressure right under the navicular bone, spleen vessel points. Moving along. Release. Press. Release. Okay. Continue with manual treatment in the midfoot. Central line. Adding tiny bit of lotion. Here's imaginary central line. Right. Ends with the mid-toe, the third one, along the third metatarsal, strokes deeper and stronger, feeling for the restrictions in plantar fascia from the heel to the toe. Midfoot restrictions right here, going along the fibers, slow release, slow release, across. Fingers alternating. Compression and distraction. And again. Compression, distraction, soothing. Compression. Distraction, compression, distraction, soothing. thin. Applying more pressure. Stabilizing. Stretching. Feeling for the first barrier. Tissue resistance. Releasing the fascia. Using gua sha tool. Moving distal from the heel to toes through the midfoot. Noticing the color changing. More lateral. Again, proximal to distal. Reversing the tool, going deeper right through the arch, long arch of the foot, helping to restore the shape, just to tone up the tissue and release fascial restrictions so the arch is flexible and mobile. And double checking. It's way better now. Fascia feels softer, mobile. The bones moving freely. Opposite direction. Compressing, bringing the arch together. Releasing and opening it. Compressing, forming the arch, and moving my hands towards the toes. Release. Stabilizing with my left hand. Compression. Using the first toe and the fifth one as my focal points. Flexion in the arch. Compressing. Adding more. Releasing. Soothing the tissue. Applying gentle pressure. Soothing more. Affleration. Massaging the toes. First spreading with the wooden stick. Supporting with my left hand. All the way from the small toe down along the arch. fourth one, middle one, second, and the first one. Checking the mobility of the first big toe joint, metatarsophalangeal. Mobilizing, traction, hyperextension and forward flexion, and release, traction, hyperextension, forward flexion, pressure, release. Mobilizing the joint capsule. Phalanges. Base and the distal one. Fluorescent. Pressing. Release. Second toe. For the mobilizing the big toe, flexing, extending, gentle valgus and varus, in and out, stretching, release, interdigital space. Applying gentle pressure, moving up, second toe, 3 phalanges, working on the base and first proximal interphalangeal joint, gentle traction, middle phalanx, and the distal traction and compression, joint mobilization, gentle hyperextension, traction, release, hyperextension, traction, release. Moving to the third one, interdigital space, getting smaller, applying pressure, proximal phalanx, medial, middle, and the distal one. Compression, tendon, release, gentle traction, relaxing. Next one, compression, gentle traction, mobilization of the proximal interphalangeal joint, middle one, distal, traction, compression, release, last one, interdigital space, compression, traction, spiral compression, mobilization, getting into interdigital space with my acupressure point, activating buffoon points. 1, 2, 3, and the last one. Mobilizing the toes in combination with compression from the acupressure stick, opening up, compressing, releasing. Once again, opening up, interdigital space, compression, release, interdigital space, opening, compression, release, and the last one with the help of the other hand, compression, deviating the toe, opening up, release. Interdigital muscle stimulation, plantar surface release, checking the mobility of the 4th and 5th toes. Still can mobilize further. The 4th one. Flexing, which means bending, traction, extension, adding hyperextension feeling for the tissue barrier resistance, gentle traction, mobilized, perfect flexion, straight extension, soothing, interdigital space, and the 5th one, adduction, flexion, hyperextension, traction. Adding more traction, gently hyperextending with the help of the other thumb. Traction, release, check. Excellent, mobility is restored. For the tissue state, nice and warm, mobile fascia, normal mobility, no restrictions. Metatarsal space, head of the metatarsals and toes. To stop, not to think that Captain Chaika. Starting our foot massage, warming up the foot, at the same time assessing state of the skin, temperature, texture, dryness. It's winter, so skin feels more dry than normal. tissue under the skin, adipose tissue, and then superficial fascia. Adipose tissue is totally normal. Checking for fascial restrictions. Distal from the heel bone, right here. Moving distal, midline, small restriction over the middle cuneiform, moving in the mid-center, along the metatarsal towards the middle toe. Again, right here, feel the restricted area. Moving to the medial side, inner side. Fascia is mobile except the base of the phalanx and the head of the first metatarsal through the midline, going to the fifth metatarsal bone. Gentle traction, release. Middle of the fifth metatarsal bone, we feel for the restriction. Fascia restriction, which goes all the way from the space between metatarsals and the edge of the fifth metatarsal, right here. Hooking it with the finger, remembering where we need to pay the attention. Moving up, checking the toe mobility, one by one. No pulling, just assisting to make the toe straight with the left hand. And checking the big one. Big one is restricted in extension, slightly restricted flexion in the first metatarsophalangeal joint, and slightly restriction in adduction, adduction. No soreness, no pain. Starting with effleurage, warming up further, whole foot, heel to toes, one by one, right, left, right, left. They meet on top. Now it's left, right, left, right. Moving down together. My hands go up together. 1, 2, 3. Now they start overlapping. 1, 2, 3, 4. So I'm starting on the inner side and end on the outer side, and vice versa, starting on the outer side and moving to the inner side, big toe, repeating that crisscross motion. And moving together. 3, adding a bit more lotion, moving to the deeper surface, deeper layers. Means we're applying a bit more pressure, starting from the attachment of the Achilles tendon. Just right here on the heel. Circular motion, making our fingers here, going back, forward, back, forward, through the midline, sideways, back to the Achilles. Now applying pressure and moving from the center, straight, every stroke closer to the outer and inner edge, straight. Now we are off the heel. Moving more central. Two circular strokes, pressure, release, pressure, release. The inner side. Feeling for the longitudinal arch, long arch of the foot. 1, 2, dorsiflexion, extension, plantar flexion, release. Moving lateral outer side, pressing, releasing, pressing, release, press, restrictions along the 5th metatarsal. 1, a bit screechy feeling. 2, 3. Using my big gua sha tool, applying pressure. Patient is reacting. Take a bit to release. Foot is getting pinkish. Applying more lotion. Using gua sha technique. Gua sha tool allows me to work on the plantar surface, the transitional zone between the 5th metatarsal bone, skin of the foot, skin of the upper area. Just changing the angle, moving along. Checking for the restrictions. Soft, mobile tissues. Moving up, which means distal, pressing on the head of the 5th metatarsal. And now I am on the metatarsal phalangeal joint, pinky toe, 5th one. Excellent extension. Limited flexion, physiological induction and good abduction. Mobilizing the head of the metatarsal. Using my acupressure tool. Applying my acupressure tool. Mobilizing the toes and applying pressure to buffoon points. Fourth one. Release. Working on the fourth toe. Again, limited flexion, good extension. Flexing, applying traction, compression. More compression, hyperextending, flexing, more flexion, extension, compression. Double check. Applying pressure to buffoon point 3. Mobilizing. Soothing. And checking the third one. Restricted motion in joint between the phalanx and the head of the metatarsal. Gentle traction first. Flexion, hyperextension, traction, then flexion. Adding the flexion of the interphalangeal joint. Making traction and extension over my tool. Release, pressing in the interdigital space. Buffoon, the point what we used between the toes right a minute ago. Release, compression, traction, compression, and moving along, proximal to distal. Release, relax. Second toe, very good mobility, contrary to those 2, 3. Move about the tarsophalangeal joint, restricting motion in the first interphalangeal, proximal. Gentle traction, flexion. Again, gentle traction, no hyperextension. Mobility is fully restored. And for the last phalanx, again using my acupressure tool. Traction and flexion without letting it go. And release, traction, just with the weight of the foot. Release, compression, and applying pressure to the first point of buffoon, Bian in some books. Release, Soothing the tissue. Hook. And using my tool as the extra hook, volcanic stone tool. Apply gentle pressure, moving up. Release. Hooking from the other side. Adding lotion. Moving up. Release. Moving up. Release. Moving up. Release. Moving up. In that case, up means distal. Interdigital space. Hook. Pressure. Going around. Release. Pressing base of the toe, feeling for the arch, gentle pull, traction to the heel, and now compressing the arch inward towards the sole of the foot, plantar direction. Stretch and open. First we open by hooking to the metatarsal heads of the big and the small toe. Releasing. Now we feel for the first, second, fourth, third, middle and fifth, basically all the head of the metatarsal, bringing them into nice arch, like this, traction and opening. Opening sideways one by one. Except the big toe, which goes opposite direction. Medial, adduction, increasing the space between first and second toes, making it a natural pattern. Flexion, extension. Pressing with my acupressure tool. Moving further, pressing again. Once again, and using it to spread the fascia. Nice roll. Checking the tissue manually. Good mobility, soft, movable muscles, and the warm skin. Improved blood supply. working on the foot using slight position of the plantar flexion to focus more of the plantar tissue. Very easy to feel for any restrictions which remain after the main treatment. For example, here in this area clearly can be felt different from the rest of the foot. Adding tiny bit of lotion and starting not here where we feel it, but from the heel moving towards the restriction. Once we feel it, we change our strokes from the straight, slow moving along. We switch to circular opposite directional movements, keeping our fingers relaxed, applying pressure, but at the same time we are feeling for the changes of the tissues, mobilizing the restriction. Subjectively it feels like the tissue is melting. On the other hand, getting warmer. With the release, the temperature increases. The molecules of proteoglycans get released. Tissue is gliding. The last point is here, closer to fifth metatarsal. Applying pressure, moving, releasing. Again. Round motion, strokes. Smoothing up, proximal, distal, opening, moving back, opening, moving back, opening, moving back. Diagonal light strokes, gentle medial to lateral movement, heel to the fifth toe, straight back, sideways, straight back, sideways, straight back. We can see the line, red line shows up. Okay, crossing my fingers and applying pressure, moving them apart. Stretching gently, pushing all the blood and intercellular fluid up towards the heel, back to the string. Gentle cross, opposite directional movements. Straight, down and up, from the toes to the attachment of Achilles. Close. It's just one fingers. smooth, easy to feel the tissue, and use gentle strokes with the extra lotion, one directional flourish. No pressure down, light pressure up. Compression, release, compression, release, gentle compression, soothing. Working on the plantar surface, checking the tissue for any restrictions which may still be unresolved. Feels smooth. Bit of tissue thickening still in the area between the heel and before the midfoot. Gentle pressure, hooking, pressing, removing, again moving back with my thumb sliding off the heel, moving towards the metatarsal heads, round and coming back, pressing around, coming back, pressing, coming back, starting from the big toe array. It's that first line. Second, moving towards the thickening, hooking my index and the middle fingers, grabbing, stabilizing with my thumb, gentle pull, pressure, switching to my index finger, applying pressure with the acupressure stick. Releasing. Again, using my hook-shaped finger, soft mobile tissue, double checking with the thumb, same way, same direction. Excellent. Pink reddish skin, soft, no sign of restriction. Good mobility of the toes, middle toe, second, and the big toe. Adding extra induction, reverse, and release, sliding back, tiny bit of a flourish and it motion towards the heel using my other finger, alternating, pressing, compressing, mobilizing, releasing the joint capsule, applying pressure to the heads of the second, third, fourth and fifth, applying traction and varus, sliding our thumbs and the index fingers. Excellent. Adding a bit lotion, soothing the tissue nice and smooth. Gentle compression and up on the heel. Compression and movement. Relaxing glide. Gentle compression with just 2 fingers. Pressing the fluid, the lymphatic fluid, intercellular, and the blood from micro vessels. Nice pink coloration of the food. Reacting well to my fingers, changing from white under the pressure to pink and reddish. Pressing around the heel, sliding, coming back, using all my fingers of both hands, including thumbs, covering, releasing. Once again, all of them, moving thumbs away, leaving just 2 on each side, just 2 index fingers. Mobilizing the mid-foot area from the base of the metatarsal towards the head of the metatarsal, pressing on hands, doing my thumb kneading, improving perfusion of the tissues. See the color change from white pale to intense pink and even red. Just the same areas getting massaged by both thumbs, alternating motion. 1, 2, 1, 2, moving lateral slightly. 1, 2, 1, 2, and towards the calcaneal bone, 1, and downward. Towards the toes. I'm using my index fingers now. precise diagnostic and treatment, feeling for the tiniest fixations, like here, alternating motion, kneading, across and downwards. Using the opposite side of the finger. Soft and mobile. Now we are moving to the area of the heads of the metatarsal bones. Mobilizing the first one in relation to the second and the rest, because it's the most massive, strongest joint. Doing mobilization of the second metatarsal, precisely feeling for the space between first and second and third, pushing it to the plantar direction, gentle press and traction of the toe. Going to the third one, cell space, pressure and attraction. Fourth, again, third and fifth interossal spaces, gentle traction with compression and holding the base of the bone, feeling it mobilized, and going to the pinky one, the fifth one. Here we have some medial deviation, working on the base, moving to the toe, traction and slight lateral deviation, grade 1 mobilization, and release, repeating, traction, grade 1 mobilization, and release. Again, using my volcanic stone tool, therapeutic effect, pressure and additional mobilization. Traction, improving interphalangeal joint. Doing the same thing for the fourth one. Second and third. And the first and second. Lotion again. The skin is quite dry. circular motion, feeling how mobile the tissue is. With my 2 fingers we can see it moves. Nice pink color, soft and mobile, and restoring the arch. First expanding the heads of the metacarpal, so the metatarsals go apart. Expanding more on the heads of the metatarsal. And then doing little traction and reforming the arch. And relax. I can definitely feel the tension right along the 5th metatarsal, plantar flexors, the 4th, the first one, tension around navicular bone, right underneath, and Achilles tendon is hypermobile. So first starting with effleurage. Applying some lotion. Same time assessing the skin tone, temperature, texture. Overworked feet. The skin is a bit rough than normal. So we need to moisturize it well. From the toes towards the heel. Nice movements back and forth. Moisturizing more, adding lotion with my fingers, using my index fingers, which can sense more precisely than my thumbs, keeping my thumbs around the heel bone, checking for the calcaneal tuberosity, moisturizing, and pressing the tissue gently and softly, feeling for the fixation around the base of the first metatarsal. Head of the first metatarsal also has some fixations. Towards the heel bone we feel the fascia is hypomobile. Midfoot has got a couple of fixations. Painless, but I still can feel them. And right here we have some fascial adhesions. Circular motions around the heel, pressing around calcaneal tuberosity. Effleurage, round motions. light strokes. Soothing the tissues, pressing hard. Here we see quite adherent fascia to the skin, not very mobile. Pressing and using my tool, volcanic stone. Adding a bit of lotion. Downward motions. Mobilizing the fascia. Feeling for the tissue response. You can see some color change from pale to pinkish. Now I'm reversing the tube and applying pressure from the calcaneal tuberosity. And down. Increasing my pressure. Mobilizing. Medial. Middle and lateral. Soothing again. And with the long part of the tool, go in the opposite direction, using that notch next to the fifth metatarsal. And the first one. And the flourish. Okay, now making our way to the midfoot. Already with the previous technique, adhesions feel less dense. Fascia is more mobile. I'm going to use gua sha tool for it. First, feeling precisely the fourth ray. 1, 2 fixations. Second ray right here. And going first counter motion. Medial and lateral with my thumbs. Stretching and mobilizing the metatarsal bones. Applying a tiny bit of lotion. And taking my gua sha tool. In the fascia, plantar flexors. Again, we're noticing changes in skin color. Go to perfusion. Soothing. Treating the other foot, the left one. Okay. Dry skin. A lot of fixation around the midfoot. Moisturizing well first. Applying some lotion all the way from the calcaneal area to the toes. Need some more in this area. Digital spaces and the plantar surface of the big toe. Good. Feels moisturized. Doing the affleurage and assessment same time. Feeling for the connective tissue cord here, which is traveling towards the head of the fifth metatarsal, base of the first metatarsal, and the refixation more than the left, on the left than the right, around the second and the third toe. And moisturizing even more. Most convenient is to use thumbs for the nice and gliding motion. I'm not applying any pressure, just gliding and taking care of the big toe, second, affleuraging, third, fourth, and the fifth one. All prepared for the treatment. Starting round-like motions in the heel. Pressing with the big toe, being with here, up, calcaneal area, down, up. With my thumbs I'm doing circular motions. Downwards, around, round, meeting, down, up, around, meeting point, and across. Circular motion on the medial side, feeling for the calcaneal tuberosity, going down, navicular tuberosity, head of the first metatarsal, pushing, gentle traction, adding tiny bit of flotion. Pressing down. Because there are more adhesions here, I'm gonna use bigger gua sha tool. Which can treat the whole plantar surface at once, holding it like handle, down from plant calcaneal tuberosity down to the plantar surface. You can see skin changes the color. Feeling more mobility. Effloration. Feels already way better around the heel bone and midfoot. So we are making our way towards the heads of the metatarsal bones and using my knuckles. I'm following the tendons of the plantar flexion. One knuckle per each ray. Now, precisely going with my thumbs, my index, thumbs, feeling each ray. Each metatarsal bone. This is the area the most fixated fascia, skin and hypodermal tissue. Applying more pressure, holding the bone, kneading the tissue and pushing on the bone, mobilizing the tissue. Fascia is getting soft and responsive. The fourth and the second and the third one needs to be mobilized. Gentle pressure, flexion and traction. We can see how the bone moves here, moving to the middle one, flexion, traction with the pressure, plantar pressure, Massage. The fourth one, flexion, extension. The fifth one, we need to use my volcanic stone tool with that hook to mobilize, holding and moving. Using that part of gua sha tool. Helping tissues to be vascularized, perfused, full of blood, pushing the extensive lymph away. Reflection and feeling for changes. Using my volcanic stone tool to push and give pinky toe some lateral deviation. Inserting, pressing, same between the second and third. Here. And pushing it down. Getting some motion. Tissues feel warm. You can see the color has changed to the bright pink. Tissue is soft. Gently checking for the bone mobility. The arch is flexible. Pressing again, spreading, holding it, using my thumbs in counter-lateral motion. Medial to lateral and vice versa. Going through all the toes, the base of the toe, applying some traction. Lateral deviation. Spreading the toes apart. One, two, three, and four. That's how they're supposed to be positioned. In a natural way, releasing them, sliding up and down. tissues. Checking and feeling for any fixation which remains, and there are none of them remaining. Down. Same with my other hand. Using my thumbs, down, up, switching, pulling apart, wide broad strokes.